Hi, my name is Tricia Crowley. I'm one of the nurses in the GPU, and I am here to demonstrate how to use the myringotomy kit and assist the ORL ENT docs with an ear evaluation under anesthesia. Sometimes this evaluation also includes assisting them in placing ear tubes as well, but not all the time. So this is to help you get familiar with the myringotomy kit and all the supplies needed and the process in which you would do this. First, I'd like to introduce our PAPB binder. So you can find all of this information in here, and you just look for the tab that says ABR Audiology Ear Evaluation, and here is a description, page 1, page 2 with pictures, page 3, and it tells all of the different instruments in, as well as a picture of the ear tube. So I would suggest looking at that and reading it prior to doing your orientation to these rooms. It's really helpful to kind of know beforehand what you're doing. So the first thing is we need a myringotomy kit, and that's what this is, and we get it from SPD. Oftentimes our scope room can get that for us as well. You also need an extension set for your suction canister, because the one that we have set up isn't long enough, so you have to be able to be versatile, go from each side of the bed. And then, like I said, not always, but sometimes you'll need ear tubes. And then the most popular one is the rutabobbin. Sometimes they come in singles, which is what these are, and sometimes they come in double packages. But they're the same thing either way. So the first thing I'm going to do is show you how to open up the myringotomy kit. I usually use a table first, and I do this before the patient actually comes in the room. So I just set it up on a little table. The kit looks like this, and it has 2 locks on the end. So you obviously make sure that's locked, and then it has a tag. You don't even have to take the tag off. In the circulator roll, you oftentimes have to scan these things. You don't have to scan anymore because a lot of things are pre-populated. So this is already pre-populated on these patients that are getting this. So how you open this is that you just pull these tabs up on the ends, and it breaks that seal on both ends. And then I'm just going to put gloves on, because you should really have gloves when you handle all your instruments. And the first thing you do when you open it is you want to make sure it has remained sterile the whole time. And how you do that is this blue piece of paper in the top of the cover. You remove by pressing this little, I don't know what you call it, this little thing here, and take this piece off. And then you can take the paper out. And what you do is you take the paper and hold it up to the light, and you make sure that there's no holes in it. There's no holes. And then you can throw it out. So now you know your kit is sterile. These other papers you can also throw out. You can throw your securement devices out. And then this is the box that comes inside, and you have to unlock in order to open it. Now, most of these things, which, like I said, is listed in the PAPB education binder, with arrows to what everything is, a lot of these things aren't even used. And so the first thing I do is take out everything that they hardly ever use, just to get it away and out of my way. So all the silver speculums, they don't seem to use. I don't know why. So I put them aside. They always use the dark brown ones. And what else don't they use? They don't use these long wires. You also have to check to make sure your sterility tab is okay. So the wires I would put out as well. I think there's normally 2 in here. And then the scissors. So what they always use is your speculums, and there's 3 different sizes. This is your 4, and you can see the number right there. And that is the middle size. Then there's a This is the 3, which is the tiniest. And then the 5. They most often use the center one, the middle, the 4. There's also alligator forceps that they use. This is, there's 3 different sizes of suction. There's a 5, which is most commonly used. There's a 7, this one here, and then there's a 20. So the biggest thing to remember with the suctions is that if the patient already has ear tubes in, then you should never use the 5 or the 7. Because if you see the holes here, it would suck them right out of the ear canal. Always use the 20, which is the thinnest. Okay? But if they don't have ear tubes, it's not a problem. And they normally use the 5, so I always hook that up first. So I keep that in my bin here. And then I keep the 7 and the 20 separate. This is the curette, which they use to take out a lot of the wax that's already in there. So they always clean the ear first with the wax. And then this is the pick, which has a cover on it, a plastic cover, which you take off. It looks like a dagger. But I wait to take that off until the patient's in the room and at the bedside. And then if you are doing ear tubes, this is the knife handle. Oh, and here's the top screw-in portion of it. So this is the knife. If they are putting ear tubes in, this is what it looks like. And you find this on the top shelf in room 2 in the left side cabinet. If they're not using ear tubes, you don't even need to get this. If it's just an evaluation under anesthesia for the ears, you don't even need this, and you wouldn't have to put it together. But I'm going to show you how to put it together just in case. So it's a very long, and it comes with a plastic cover, a very long knife. And this piece here, it just falls in at the top. And if you see, there's a long side that goes down and then a short side. So the long side is where you put it into the knife, put it down in, and then put it in here, and then you just turn until it gets snug and just lock it in there. That's how you do that. And this is how long the knife is. Okay. So now I'm pretty much set up except for my suction. So I already got my suction ready. And I already had the extension on there, so I didn't want to open another one. So I have this right here at the bedside. They'll bring the patient in the room. You'll help get them settled. They'll get off to sleep. And then you obviously have the ear microscope brought up from the OR. And then they often start on the left side, doesn't matter really, but you're on the opposite side of the doctor. So I'd be on this side of the bed if the doctor was on that side. And once the patient's asleep, I would bring my kit right to the bedside. Just gonna put that up a little bit. And the first thing I do is put the number 5 suction onto my suction tubing, okay? And this isn't sterile, so you can just lay it down or lay it on the bed, lay it on the patient. The other thing we need to often, because of so much cerumen built up in these kids' ears, is just a gauze, because they'll often pick it out and then ask you to wipe. So you're just kind of standing there ready to wipe for them so that they can go back in and get more. So you can take that from Anesthesia's cart here. So the first thing that they'll ask for is the number 4 speculum. You have to think about how they need to put it in the ear, so you're giving it to them backwards. So basically all you do is you pick it up like this. You grab it and you hand it to them, because they're gonna then take it from you this way and put it in the kid's ear. So they're looking into the microscope like this, right? They got the microscope right there. And then the next thing they normally ask for is the curette to get the wax out of the ear. How you should hand them the curette is also, so how do I describe this? You want them to be able to just take it in their hand and go into the ear. So you're basically handing it to them like this. Like, just like the speculum, you're going on top, just like the loop, you're going on top. And you're handing and placing it in their hand like that, so that they can go right in. So it's laying across their hand, okay? And once again, they're using this, and then they're saying to me, oh, can you wipe this? And they just they don't even take their eyes out of the microscope sometimes. They just lift this and say, can you wipe? And you wipe. And then they go back in. Can you wipe? Back in. Can I have the suction? Now the suction's gonna be the same way. They'll just drop, sometimes they'll just drop it, and then you wanna pass the suction so that they can use it right away. So you're just handing it to them once again over their hand so that they can, if they're a righty, obviously, so that they can use it. So it's kind of draped over their hand. So you tend to wanna like do this, but it's backwards, this way, okay? If they are using and putting ear tubes in, you often need, so they'll say, can I have the knife? So you will hand them the knife. Normally when they say, can I have the knife, either you or they announce, knife is going in the ear. Because people tend to lean on the bed, and you don't want anyone leaning on the bed, shaking the bed when a knife is in the ear. I think that's just really important. So I'm gonna hand the knife, once again, from the top, so that I can hand it to them in their hand. Can you put your hand out? Yes, perfect. So that they can just go right in. And they'll say knife in the ear. Everyone pauses and doesn't move. Then they'll take it out. Sometimes they'll want suction, so you can get a normal saline syringe from Anesthesia, and you'll just maybe squirt a little bit in for them, hand them the suction back possibly. Sometimes they need to use the pick to adjust where the tube is, and I'll show you how to put the tubes on. But yeah, let's do that next. Okay, so the tubes are a little challenge, but I was taught a little trick. So this is the pick that they will sometimes go in the ear to adjust and tip the tube where they want it in place, but it's also very helpful to just load your ear tube. So it's basically right on the top of that. You're gonna take your alligator forceps, and oftentimes you have to ask the physician, do you want it loaded on the bottom or the top? And that means on the bottom of the ear tube, like so. And it should be straight on. and it's not easy. You can hold it and adjust it with your hands if that's easier. There we go. So it should be straight on. I can show it to you this way. Now, handing it to them seems a little scary because it can come off so easily. But what I have found is that if you turn your left hand, squeeze it together to let go and don't let go, turn it and hand it to them. Can you put your hands, nope, the other way, like you were gonna grab it, yep, through the, perfect. And then I say, do you got it? And they say yes. And then they're able to, so it's this motion here. I'm gonna do that again. So you're here, here, and you're squeezing it so you don't lose the ear tube, and then there, okay? And then next they'll sometimes ask for the pick once they get it in the ear, and I would hand them the pick the same way. Your hand, right, so that they're ready to use it. After they get the ear tubes, you often use oxflin drops and little gauze or cotton ball to put in the ear. When they're finished with that side, they'll say, great, we're all done, and then we'll switch sides. They'll move around to the other side of the bed. I'll take all of my stuff, move around to the other side of the bed, and we'll do the same thing on the other side.